Imagine for a moment you're walking through an ancient city on the banks of the Ganges, more than 2,500 years ago. The year is roughly 600 BCE, and medicine isn't what we think of today. There are no hospitals as we know them, but there are learned sages and physicians who study and practice deeply. One of them is Sushruta, often called the father of surgery. He's not just a healer, he's a surgeon, a teacher, and an innovator whose ideas will ripple through millennia. His most famous work, the Sushruta Samhita, isn't a pamphlet or a brief medical text. It's a comprehensive surgical manual covering over 300 surgical procedures, more than 100 instruments, and detailed anatomy. Here we will emphasize on the nose. Why nose reconstruction was important. Why are we talking about noses? Because in ancient India, the nose wasn't just a facial feature, it was a symbol of honor, dignity, and social standing. Here's the darker side. In that society, nose amputation was sometimes used as a punishment for criminals or even for women accused of adultery. Losing one's nose meant more than physical disfigurement. It meant social stigma, exile, and shame. Into this grim reality stepped Sushruta, with surgical ambition but also a deeply human goal to restore what was taken. So what exactly did Sushruta propose? His method, described in the Sushruta Samhita, may sound simple but was remarkably sophisticated for its time. Measurement. First, Sushruta suggests measuring the missing piece of the nose using a creeper leaf. Flap surgery. He then cuts a piece of skin, not from some random place but from the cheek, leaving a small pedicle, a skin bridge, still connected. Attachment. This flap is rotated to cover the nasal defect and stitched on. Support. During healing, to keep the new nose's structure, he inserts two thin tubes from castor oil plant into the nostrils. Aftercare. He dresses the wound with a powder made of herbs, licorice, sandalwood, barberry, and keeps it clean with cotton and sesame oil. Adjustment. If once healed the nose is too long or too short, he suggests recutting and reshaping the flap. Remarkably, some of these ideas are mirrored in modern reconstructive surgery. For instance, the Indian method, especially the use of skin flaps, influenced how surgeons reconstruct noses even today. Sushruta wasn't just performing surgery because he could. There was real social demand for his techniques. The nose, in his time, wasn't a cosmetic afterthought. It mattered deeply to people's identity, their place in society, and their sense of honor. He also emphasized precision, training, and ethics. Students had to practice on things like vegetables, leather bags, or animal bladders before operating on real patients. That's surprisingly methodical. It's not just folk medicine, but a systematic surgical tradition. This ancient Indian story connects to the West. Sushruta's techniques didn't stay hidden forever. In the 18th century, Europeans took notice. A surgeon working for the British East India Company saw a nasal reconstruction in India that closely mirrored Sushruta's method. That account was published in the Gentleman's Magazine in London in 1794, calling the technique practiced from time immemorial. Then, in 1814, a British surgeon named Joseph Carpuet replicated the procedure successfully on two patients. One had lost his nose to disease, another to trauma. Over time, that flap-based reconstruction approach, especially using the forehead, became a foundation for modern nasal reconstructive surgery in Europe and beyond. So, the Indian method of nose reconstruction became part of the global surgical tradition. So next time someone tells you plastic surgery is purely a modern invention, you can tell them its roots run deep, all the way back to ancient India and the teachings of Sushruta. What seems like a high-tech procedure today actually has a legacy stretching over 2.5 millennia. By weaving together social history, surgical ingenuity, and cross-cultural impact, this story isn't just true. It's a powerful reminder that innovation transcends time.